In many states, it's now mandatory to wear a mask when you leave your house to help stop the spread of COVID-19. President Trump has mainly avoided wearing a mask in public, saying, in fact, he's not worn a mask in public at all, saying last week in Michigan he did not want to give the press the, quote, pleasure of seeing him donning one. So how did masks become so politicized? North Dakota's Republican governor, Doug Burgum, became emotional when pleading with Americans to put politics aside.
If someone is wearing a mask, they're not doing it to represent what political party they're in or what candidates they support. They might be doing it because they've got a 5-year-old child who's been going through cancer treatments. They might have vulnerable adults in their life who are currently have COVID and they're fighting. If somebody wants to wear a mask, there should be no mask shaming.
Joining me now are Dr. Vanessa Carey, the CEO of Seed Global Health and also an emergency critical care physician at Mass General in Boston, and also Rick Stengel, former Undersecretary of State during the Obama administration. Welcome both. Dr. Carey, first of all, how do you as a critical care physician feel about the president not wearing a mask in public and not modeling that, in fact, objecting to it and turning it into a political thing, a machismo thing, or a red-blue thing? I'm not sure quite what it is. What is so difficult about wearing a mask, and how does it protect not only yourself, but most importantly, other people and the healthcare community?
So thank you for having me on today. You know, it's been incredibly disheartening to see the mixed messages coming out of this administration about how to take on the COVID pandemic. The reality is that the United States has about 1.6 million of the world's 5.5 million cases. We have also about a third to, we have almost 100,000 deaths now. In the world's 350,000 deaths. And so we are not doing this right. And what I'd like to have seen would be a consistent, solid message about how to keep Americans safe rather than sacrificing them. As a critical care physician who's been working in the ICUs at Mass General, where we've been incredibly hard hit in Boston, I have been walking rooms full of people who should not be sick, but were put in a situation because our country did not protect itself well enough and is not putting out constant messages. Masks are very important to not only protect yourself, but to protect others in the community. And they've become politicized because we have a president who has basically told us that they don't need to matter, or that, they're not significant enough that even he needs to wear one. And I think it's very difficult for people to want to follow when they're not being shown a consistent message from the top.
Rick Stengel, how did America, which has always led the world through every, health crisis, Ebola comes to mind, but going back decades, how did America become such a follower, so far behind?
It's a good question, Andrea. I mean, we've been the gold standard in detection of disease and control of disease, but we have a scientifically illiterate president at the top who I think influences all of these doctors and scientists below to kind of ignore the data. Like what we're talking about with masks. I mean, we've politicized the wearing of masks. We've politicized everything in this country. And I would argue that President Trump has weaponized the wearing of masks. If I had to give it the most benign interpretation, it would be the people on the right who say that the mask is an imposition. It represents control of big government, and they want their freedom from that. And people on the left who say this is the best use of government to protect us, to protect other folks. That's the most benign interpretation of it. But Trump, as I say, has weaponized it to energize his base, to turn people against each other, to turn red versus blue. And that is really very, very dangerous. And if I have to go back to what the governor of North Dakota said in that lovely speech that he gave, he ended it by saying, let's show some North Dakota kindness. Wearing a mask is an act of kindness. It's an act of kindness towards other people. It's an act of kindness toward yourself. It's an act of kindness towards society. And as Dr. Carey said in the great work that she's doing, that's what we need to do as a society, particularly on this Memorial Day, where people have sacrificed their lives for these values over our history.
I would just say it's also an act of patriotism. Dr. Carey, as the CEO of Seed Global Health, also, do you have concerns that if there is a vaccine, and we don't have much time, and this is a big question though, if when we get a vaccine that it won't get to Africa, to some of the other countries that are less advantaged and need it most, perhaps?
I mean, I have a concern about every person on the face of the earth right now in the face of COVID, be it here in the United States or abroad in Africa, where Seed Global Health is helping to support building health systems. I just got a message from the government of Sierra Leone, or a colleague who works with the government of Sierra Leone, that they've just experienced their first death. And their response, though, wasn't just, how do we get a vaccine? Their response was, we need to build our entire health system. And I think that we've seen that, whether we're talking in communities in Africa where the health systems are very fragile and don't have the resources needed, that COVID is going to be a problem. But we're seeing it in this country. I mean, the thing that's been so disheartening to me here is that COVID has exploited communities that don't have access to regular health care, cannot socially distance, are essential workers, fall among the more poor in the United States. And what we're going to see is that those countries that expand Medicaid and don't have full health systems are going to be the states that get the hardest hit when all is said and done. And so the reality for me is, vaccine or not, we need strong health systems everywhere around the world. Health security is individual, global, national, all security, and we have to find a way forward. I do worry very much about distribution networks of vaccines, because you have to have strong health systems to distribute vaccines well. And I think looking at equity issues, whether it's abroad or in the United States, is going to be a real issue, because we're seeing it play out all the time, every day, just in where COVID infections are happening. And so as we look to putting a vaccine out there, it's going to be critically important that we think about how we deliver vaccines to those communities that are the most vulnerable, the hardest hit, and how we get a vaccine up and out in an equitable way to protect all. And in the meantime, we need to wear masks. We need to social distance. We need to be responsible as citizens. I find it very poignant that we're looking at 100,000 deaths, on Memorial Day, a time when we remember and honor those who have served this country. And I think we're looking at a new kind of sacrifice in this country right now, and it's very painful.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.